Coxiella burnetii is an obligate intracellular gram-negative bacteria and is the causative agent for the zoonotic disease quarry fever or Q fever. The rod-shaped bacteria relies on its eukaryotic organisms as its host. In particular, this is livestock like cattle, goats, and sheep, but also arthropods like ticks. And it's often spread through aerosol transmission, so this has raised a lot of concerns about it being used as a bioweapon. So Coxiella is highly environmentally stable because it's able to adapt to different environmental stresses because of its biphasic life cycle. So essentially, the bacteria can be found as a spore-like formation, and this is called the small cell variant, and it's resistant to a variety of environmental stresses and nutritional stresses, such as temperature changes and nutritional availability. And once the environment is favorable for replication, the small cell variant will then transition to the large cell variant, and this is highly metabolically active, and this is where replication is favored. So because the bacteria is an obligate intracellular, there's more nutrients available for it to proliferate inside its host cells, hence it has a higher metabolism and can replicate profusely.
Q fever was first identified as a human disease in Australia, the home of Coxiella burnetii. It was called quarry fever at the time of discovery, now shortened to Q fever, in 1935 Brisbane, because the cause was unknown. Since that fateful day, Q fever has been seen across the world from a range of animal hosts, but remains closely associated with the agricultural and farming industries. Your primary reservoirs will be your livestock animals like cattle, sheep, and goats, but keep an eye out for bandicoots, kangaroos, cats, dogs, camels, and ticks, among many others. As mentioned previously, due to its biphasic life cycle, Coxiella burnetii is super durable outside a host. It can persist in the environment for extensive periods, including up to 150 days in soil and 2 weeks as an aerosol, so these animals aren't your only chance of getting it. As such, it can be transmitted through a range of methods, including respiratory routes, cuts and abrasions, food-borne and vector-borne methods, and, although rare, person-to-person transmission. While animals often tend to be asymptomatic, they can still give off infected animal products, which are the key factor infecting humans. These exist in the environment as aerosols and can arise from the fine mists from the delivery of offspring, slaughter of livestock, handling of infected animals, and other things that can lead to human infection. Men aged 40 to 60 are the key demographic affected by Q fever, largely due to their representation in the farming and agricultural industries, with Q fever being more of an occupational disease than anything else. Couple that with an address in New South Wales or Queensland, and you've got one of the highest risk factors of being exposed to Q fever. However, not all infected individuals fit into these categories. Exposure can occur from domestic animals, like living with your cat or your dog, or even living in proximity to infected farms, as these aerosols can travel up to 5 kilometers away from the point of infection.
So now let's talk about pathogenesis of Coxiella burnetii. So in animals, C. burnetii can either be asymptomatic or cause cocciellosis, which tends to manifest as a chronic infection of the mammary glands and uterine tissue, where it replicates and spreads to the external environment in large numbers during parturition. And this is essentially the small cell variant. So once the small cell variant enters the human body through a route of transmission, it infects alveolar macrophages and replicates in the lungs by essentially forming an acidic Coxiella-containing vacuole inside the macrophage. So once the bacteria is in the vacuole, it transitions to the large cell variant, and this is where it's able to replicate and will eventually release novel bacterial isolates, allowing the progression of acute and chronic Q fever. So Q fever can manifest as an acute infection over a 20-day incubation period by replication in the lungs, and around 60% of patients are usually asymptomatic. However, they can also present with flu-like symptoms like a high-grade fever, severe headaches, muscle aches, and even extreme fatigue. But this is an infection that is self-limiting and will clear up within 2 to 3 weeks. However, it is also common to see pneumonitis and hepatitis manifesting in an acute infection. So chronic Q fever infections occur within patients with immunosuppression or pre-existing cardiac conditions, and this can consist of reoccurrences of flu-like symptoms, but also have a high risk of developing into endocarditis and potentially meningitis, which is fatal. The cardiac symptoms of Q fever have been attributed to the production of autoimmune IgG antibodies. So what makes Coxiella so effective at causing disease? It's the specific virulence factors that allow the bacteria to overcome host defenses and cause disease. The virulence of the bacteria relies on phase variation of lipopolysaccharide, or LPS. Phase 1 is highly virulent, where the full-length LPS is expressed, and this is highly immunogenic, whereas Phase 2 LPS is truncated and removes certain polysaccharides and the O antigen, so it's completely avirulent. The phase 2 LPS is mainly produced for energy conservation purposes and is easily destroyed by phagocytes, so this is usually the cause of acute infections. So the phase 1 full-length LPS rearranges the actin cytoskeleton of the phagocyte as it enters a cell. This is a process called membrane ruffling, and this prevents the activation of toll-like receptors 2 and 4, which then inhibits the production of certain cytokines like TNF-alpha. Additionally, phase 1 LPS is very poor at complement fixing due to the O antigen, which prevents opsonization, whereas phase 2 is highly sensitive to C3b through the alternative pathway. Now, C. burnetii uses the .ICM type 4 secretion system, and this is activated when the small cell variant enters a macrophage. The T4 secretion system ejects a unique set of effector proteins into the host cell as a means of manipulating the host cell's metabolism to its own benefit. For example, it uses the metabolic functions of the endoplasmic reticulum to physically construct the acidic vacuole, and after the vacuole is formed, it starts to mature by binding to developing endosomes, such as the early endosome, and eventually binds to the lysosome with the help of these effector proteins. Now, since Coxiella is an acidophile, it can tolerate the low pH of the lysosome, so the entire vacuole is acidic with a pH of around 5.2. So the effector proteins establish a safe niche for the bacteria to replicate in by preventing apoptosis of the macrophage, inhibiting NF-kappa B signaling pathway, allowing the bacteria to replicate.
If you happen to be handling animal births on the regular or living in proximity to an infected farm, fear not. There are diagnostic methods, treatments, and preventative measures to protect you from Q fever. Initial diagnostic tests tend to use serology or bacterial nucleic acid detection using blood cultures, although Coxiella Burnetii cultures should be avoided because they require super specialized lab techniques and can pose a risk of infection in the lab. But diagnosis requires a multifaceted approach that combines patient history, examinations, and testing. Serology can help diagnose acute infection, where IgA antibody concentration must be shown to increase over the course of a week. Diagnosis for chronic Q fever also tests for these antibodies plus IgG, but over a longer time frame. Nucleic acid testing uses PCR on a blood sample. However, this tends to require rapid action and testing, as the bacteria may be removed from the blood pretty quickly. Couple these with an itinerary of your recent animal interactions, and you may be able to get yourself a comprehensive diagnosis. Most acute Q fever infections don't need antibiotics, but if necessary, treatment can involve a 2-week program of doxycycline antibiotics that target the bacterial protein synthesis. However, others may need specialized treatment plans. In comparison, chronic Q fever needs a combo of doxycycline and hydroxychloroquine with other antibiotics. Preventative measures such as hand washing and N95 masks can protect people in high-risk occupations, while vaccination by itself is a pretty good option. QVax, the vaccine, is estimated to be 83 to 100% effective and uses a formalin inactivated culture of whole cell C. burnetii. It's a one-time vaccine and requires a blood test and QVax skin test to ensure that the individual has not previously had Q fever or the vaccine. The Q fever vaccine has been used in high-risk occupations since the 90s, but does have limitations due to public awareness and general costs that may hinder vaccine uptake. Vaccinations are currently being encouraged and pushed for in high-risk areas in Queensland due to a recent spike in observations, calling for the first Australian alert to the disease in years, impacting not only the general public, but also the much-anticipated return of "I'm a celebrity, get me out of here" to Australia.
Perfect!